Hello, hello, hello. It is me. I am Dr. Joy Fremont, Miss Dr. Lady, coming to you live from Hapeville, Georgia. That's where my office is. 404-761-1659. That's 404-761-1659. Good morning. If you were here live with me this morning, hello. Please say hi. I hate being here alone. No, actually I don't. I'm pretty good at being by myself. But if you're here live, say hello. Hi. If you're here on the replay, just type the word replay down below. But I'm here to talk to you about, just for a few small moments, because we're starting our day, dry mouth. Okay, is your mouth unusually dry? I don't mean like in the morning when you wake up and your mouth is a little bit dry. Overnight, I mean like you really know your mouth is really dry. Whew. It's not very fun. It's not very pleasant. It's quite uncomfortable for a lot of people. Nonetheless, is that you? It could be. For our ladies out there, you know, my ladies, a lot of times when we are perimenopausal, premenopausal, postmenopausal, even going through menopause, your mouth is unusually dry. And it also goes for our ladies who are going through your cycle at time of the month, which leads to hormones, right? So hormones can cause your mouth to be unusually dry. Also, there are several medications that are out there, primarily a lot of medications for persons who have high blood pressure. Hypertensive medications, a lot of the side effects are pointing to dry mouth. There's no way in the world that I'm telling you to stop taking that medication, right? Come on, I'm not doing that. But I want you to be aware of what may be causing your mouth to be dry. Once again, I don't mean just waking up, oh, my mouth is dry, I'm gonna get some water and you're all good. No, I mean the uncomfortable feeling of your mouth being dry. Hello. So what I want you to do is understand that it is real, and there are solutions. And one solution is do not get off that medication, because that medication is for you. And however, you know, if you're going through the change, if you're about to just finished it, or you're going through that time, some things you just can't change, all right? So there are some supplements that you can use. They're over-the-counter products. One of them is Biotin. Now, I like Biotin. I've used it with my patients for several years. You can buy it in any drugstore. But the formulation of Biotin has kind of changed over the last few years. It's not as, they took something out of it that doesn't make it quite as potent as it used to be. So, Biotin, please go back to the way it was. Thank you. My patients love it. All right. That's one thing you can do. I'm just saying. It works, but there are also other products. And there's also one that I'm going to come back later on today and show you about. It's called Salivart. I'm going to actually show you how to use it. We do have it. It's not over the counter. You have to get it from your doctor. I don't get any money off of it. I'm just trying to help you, okay? I'm going to show you about that. And definitely stay hydrated, or even overhydrated if you're ever in the position where you have dry mouth. Because what happens is, not only is it an uncomfortable feeling, it leads to decay. All right? Because, you know, your saliva moisturizes your mouth, right? And the more moisture you have in your mouth, the less likely it is for you to get decay, because that saliva tends to wash away or rinse out those things that are not supposed to be in your teeth. Okay, so if you have a dry mouth, bacteria loves dryness. Okay, it sticks to your teeth. The plaque sticks to your teeth easier if your mouth is drier. And what happens when plaque builds up? One, it can cause gum disease if it's not removed, and two, that bacteria can cause decay, right? So those two things alone are side effects of the side effect of having a dry mouth. So if you know you have this, you have to be way more diligent in taking care of your teeth. You have to brush your teeth more often. You have to definitely floss. You can't afford to skip. Okay, you are going to have some problems, all right? So don't think, oh, I have dry mouth, I'm going to get a cavity. I'm telling you right now that you can prevent it. You can slow down the rate of decay. You can stop that gum disease from coming if you take care of your mouth, knowing what's about to happen. Because I'm telling you, it's about to go down if you don't take care of it, all right? So that's just my word of encouragement. If you have dry mouth, or you're not quite sure if this mouth being dry kind of transient, call me. We'll do an assessment, or even contact your physician or whoever gave you the medication and say, hey, you know what? This medication is drying me out way too much. Are there alternatives? They can give you a prescription, because there are prescriptions that we can give you to actually increase your salivary flow. Or go to the drugstore, go to CVS, Walgreens, Walmart, whatever it is, and get the dry mouth spray. There's a dry mouth ointment. There's a rinse you can use. Do it. Do whatever you can to make yourself better. I'm telling you, although it's quote unquote normal, it's something that you can take care of and fix, even if it's just temporary, okay? So those just a couple of words. Oh, one last thing you can do. You can get some sugar-free lemon drops. I started off with the word sugar and free, right? Sugar-free lemon drops, because those things kind of, you know how you take something real sour and makes you feel it right here? That is, down here are your salivary glands, all right? It activates them to produce saliva. So if you like candy, get the sugar-free lemon drops, all right? Go to the drugstore, put them in your bag, put them in your purse, put them in your car, whatever you do. Take those and watch how that changes things, okay? On the whim, you'll have more saliva, because this is like, ooh, come on, just do this for a minute. Y'all have all done it before, because I know I do it, all right? So that's your salivary gland or glands being activated to produce more saliva, okay? Hey, I've given you some tips this morning already, and I got to go, all right? So once again, Dr. Fremont, 404-761-1659. If you need an assessment for dry mouth, know someone who needs one. Oh yeah, dry mouth, also called a stinky breath, but talk about that later. Give me a buzz, 404-761-1659. Drop me a comment down below and share it. So like this video, guys. Press the like button. Share it with somebody, all right? And definitely comment. I love to read your comments. Yes, I do read them. If you have anything that you want me to talk about, I'm here for it, all right? Have a great day. Bye-bye.